Let's talk about amelogenesis imperfecta. This is a very important question and it is usually asked in vivas and exams. So first of all, coming on to the definition, it is basically a heterogeneous group of heterogeneous disorders, hereditary disorders of enamel formation affecting both deciduous and permanent teeth. Now, what is usually seen is that only the ectodermal component is affected. Ectodermal component is affected. Now, what is the ectodermal component of teeth? It is enamel, right? And the mesodermal structures are normal. So, mesodermal structures, they are normal. So, what are mesodermal structures of teeth? Dentine, pulp, cementum. All right. Now, we will talk about some other names. In other names, we can mention the hereditary, brown, enamel, hereditary brown opalescent teeth, and hereditary enamel dysplasia. Now let's talk about the classification. Now you can classify them into basically in two ways. So the first one being based on how it is spread. So generalized, smooth, and localized. In generalized, what we see is that entire it is affected, such as there are pinpoint pits, whereas in localized, what you will see is that there are pits and they're present in the buccal middle third, basically only some teeth. Over here, entire dentation. And in this one, it is smooth, it is basically thin. And now we will classify them into the main thing that is usually asked. So they are basically divided into four types. So 2, 3, and 4. You can remember as PC, CM, PM, CM. Yeah. So the first one being P, so hypoplastic, hypomaturation, hypocalcification, and hypomaturation plus hypoplastic plus taurodontism. Now I mentioned about this in taurodontism video as well. So in hypoplastic, what you see is that there is a defect in the enamel matrix. So defect in enamel matrix. In maturation, what we see is that there is defect in the maturation stage. Then in hypocalcification, what we see, it is basically a defect in mineralization. And this one is very rare, type 4, and it is seen in trichodonto osseous syndrome. Alright, now in the first one, what you will see is that it will have a thin enamel, alright, thin thickness. And over here, what you will see is it will have normal thickness, but it won't be hard. In this, it will be soft enamel, right? And it can be easily removed by a blunt incisal instrument. Uh, Also, a very characteristic white opaque flecks are seen in this one. Now let's talk about the color in Amelogenesis Imperfecta and the clinical features. The color, it can be white, brown, yellow. Also, what you see is that the contact points are not even closed because of the incomplete or the lack of formation of enamel or due to the early loss of enamel. So open contact areas. Why? Because of early loss of enamel or lack of formation of enamel. Then it is having a cheesy consistency. It can lead to attrition and anterior open bite. Now let's consider the radiographic features. In radiographic features, in the hypoplastic stage, you will see that the density of enamel, radio density of enamel is more than dentine. But then in hypo maturation, what you will see is it decreases than the normal dentine. Then in histopathology, what we will see is we will see immature ameloblast that have not differentiated yet. Also, in the treatment, what we give is we give facial veneers, dentures, or crown, and so on. So this basically covers the whole of it. Then there is one more important thing to remember of. There is a term called as lionization effect. Now, what is lionization effect? It is basically something which is X-linked autosomal dominant hypoplastic type of then Amelogenesis Imperfecta. So what actually happens is in a male and in a female, it gives different manifestations. So what will happen? The male has X and Y chromosome. So what happens is if the it is basically transmitted from the mother. So if from the carrier mother. Now if the boy is having X and it is defective, then you will see that the entire enamel will be defective. But in female, if one of the chromosome is stable and it is not defective, and if one of the chromosome is defective, so what you will see is you will see phases. You will see abnormal enamel being laid down and normal enamel. You will see a pattern. So this is what they call as lionization effect, and it is usually seen in the females who had a carrier mother, or maybe they were the carriers, and so on. So I hope you understood. Thanks for watching.